My name is Dr. Gideon Kwok, and I am an aesthetic physician here in the Southern California area. Been doing aesthetic medicine for about 20 years now. So when my patients come in and I am consulting them about what they need, I think that MiraQ, the BENEV threads are an amazing additional tool. Newer to the US, but in the grand scheme of the marketplace, in the global sense, we've been doing threads for 20 years. But threads are going to be here to stay. They're not an alternative to a facelift, but they're a bridge for when patients don't want a facelift or are not ready for a facelift. They're there to reposition, pull up some of that jowling, pull up some of that heavy tissue, and reposition it up. We're using suture materials that have been used in medicine for over 30 years. They dissolve away, but you get a longevity of about 1 year to 2 years of something that's non-surgical, that you walk out and you get immediate results. So evaluating this patient from before and afterwards, these are going to be your typical patients. These are patients that are starting to see a nasolabial fold, this cheek is starting to droop, and then everybody hates this jowl. And so this patient probably came in to see this practitioner to really reposition, lift this jowl up and soften out this nasolabial fold. And you can see beautifully done. The accentuation of the jawline, you can see how it connects into a single line now. There's no real jowls. There's a little bit of a softening and effacement of this nasolabial fold, as you can see in that aspect of it. So beautiful job done. You can see a little repositioning of the fat pad back up that was not here, so she looks like she got a little bit of filler. A lot of our patients don't realize, but as we age, this volume loss and the loss of tissue and bone support causes the draping of the face. And so what we're doing with the threads is coming in, typically near the hairline, underneath in the fatty tissue, placing the threads, you cannot see the threads, and repositioning everything back up. I really want to just thank all my patients that trust me. I think in the field of aesthetic medicine, there are so many choices out there. I hope that people out there continue to look for the best of the best out there.